becomes inefficient at moving sugar into the cell. So the small cells in the eyes are the first to go because they're missing that element first. That's why peripheral vision is first to go, and the patient's vision goes like this. They call it tunnel vision. And it's, again, pretty profound. 4.2 million were diagnosed with it in 2005, and that rate is increasing at about 6% per year. Kidney disease. A lot of people are flirting with possible dialysis or know someone that is from complications. I know a few. Diabetes is the leading cause of kidney failure and accounts for 44% of all new cases annually. That's almost half. An unacceptable number. With an average cost of dialysis per patient of approximately $60,000 per year. Whether you pay it or your insurance pays it, somebody pays it. Nervous system disease. 60 to 70% of people with diabetes have mild and severe forms of system damage. Charcot's joint is a form of knee trauma caused by the inability to feel your legs and running into things. I thought my uncle was inflicting injuries on his legs when he had bruises all over. I didn't know what it was from, but that's exactly what he had. So you don't feel your limbs, you burn your hands, or you have constant bruises on your legs because you can't feel the nerves because they're slowly dying. Amputations. More than 60% of all non-trauma amputations are caused by the complications of diabetes. Dental disease. Dentists dislike treating diabetic patients. Why? Because it's so difficult, they're so unhealthy. Pregnancy complications. 3 to 10% of all pregnancies are gestational diabetes. Does not have to happen. Recent medical studies, one from the Department of Medicine, Kuriumi, Japan, School of Medicine, show that people with diabetes are at increased risk of certain gastrointestinal cancers. When we think about the diabetic, what they eat, it's very damaging to the gut. That seems reasonable. There's a reasonable correlation between what we eat causing diabetes and damaging the lumen or the lining of our gut. Seems really reasonable. I quote now from the report. Diabetics are twice as likely to be diagnosed with liver, pancreas, and endometrial cancer. They're 20 to 50 times more likely to develop colorectal cancer, bladder, and breast cancer. Now, to be honest, there is some debate whether there's a direct causality between type 2 diabetics and cancer, and the research is ongoing. But I'd rather not risk it and wait. I'd rather change now. Secondary disorders, again, are not written in stone. The research over and over again proves that. None of the dangerous outcomes have to be part of your future. You have the power to take control. The power rests with you. An added bonus to actively engaging in how your disease is treated is that you not only feel better, live longer, but you save money too. And another bonus that I'm seeing from my patient is a personal sense of well-being. Nothing to do with health, they just personally feel better about themselves. I don't know whether you want to call it being empowered or knowledge or lack of ignorance, but it's just a shift in their personalities, and it's nothing I ever expected. So 174 billion was spent on treating and diagnosing diabetes in 2007, and it's going up about 6 to 8%, or some numbers say 10% per year. So we're close to the $200 billion range. That's some big bucks. 116 million was direct medical costs, doctor's visits, medications, supplies, test strips, meters. 116 billion, these are all with a B, not million, but billions. It is also estimated that the out-of-pocket expenses for insured diabetics is between, the numbers vary, $6,000 to $10,000 a year is what the average insured, fully insured diabetic will spend. Though the mainstream and medical pharmaceutical industries may say otherwise, developing one of these complications are not inevitable. I cannot stress that enough. It's not inevitable. In fact, there are ways you can prevent and reverse type 2 diabetes today. Like a lot of other diseases, type 2 creeps in slowly. It's called insidious, which means it comes on slowly by a lack of certain foods or too much of others. But it's directly linked to our lifestyle. There are real options that don't rely on adding more meds to your prescription or changing dosage or waiting for that miracle cure. It's a fantasy. We hear a lot about a healthy diet. How many of you have been told to eat a healthy diet and then left with no tools? Don't know what to do. You rely on the media, or the television, or the latest fad, or organic this or organic that. I feel frustrated when I see that. I know better, but I know most of you don't. A lot of it is hogwash. Let's see what the leading diabetic organizations like the ADA have to say about proper eating. This is from their website, the American Diabetes Association. They say, drink low-calorie drinks, the ones with NutraSweet, aspartame, asulfame K. Drink low-calorie, there's no sugar in them, it's great. But what does a historical record and peer-reviewed research have to say about additives like that? This is from the Diabetic Clinic in the University Hospital in Iceland, and all they do is diabetic care. This was published in The Lancet. The Lancet is another highly reviewed, peer-reviewed journal where doctors get together, read these articles, and then publish them. So it's a very diligent process to be in The Lancet. Evidence, and this is the title of their report, Evidence for Food Additives as a Cause of Diabetes. And in the report, they go on to say there's evidence of what they call a causal link. Yet the ADA recommends them. The ADA also receives funds from Coca-Cola, Mars, and other fast food companies. Doesn't seem very reasonable to me. Have you ever been told what foods have a significant impact on blood sugar? Here's another research paper from the Institute of Cerebrovascular Disease, University Medical College, Shandong, China, this year, May of this year.